Good morning, everyone. We, the Sarji Institute of Nursing Sciences, observing World Vaccination Week. It is a week dedicated to raising awareness about the life saving power of vaccines. So, vaccines are one of the greatest advancement in medical sciences. They protect not only individual children but also entire communities by preventing the spread of deadly diseases such as polio, measles, and tuberculosis. They give children a chance to live healthy lives free from the burden of preventable illnesses. Yet, despite their proven effectiveness, many children remain unvaccinated, leaving them vulnerable to life threatening diseases. Vaccination is not just a medical intervention, it is a responsibility, a duty we owe to our children and to the society. By vaccinating our children, we ensure their right to health and contribute a stronger, healthier future for all. Let us join hands this World Vaccination Week and pledge to spread awareness about the importance of immunization. Let us inspire every parent, every caregiver to ensure that their children receive all recommended vaccines without delay. Together, we can protect lives, reducing suffering, and achieve a world where preventable diseases are no longer a threat. As we all know that our nation is called as polio-free nation. So not only polio-free, we have to join together to fight against all the vaccine preventable diseases from our nation. So today we are observing World Vaccination Week 2025. So hereby we have arranged a webinar on basics on vaccination. As we have the first year BSc nursing students from Sarji Institute of Nursing Sciences Shimoga, I request all the students to take your turn according to your roll number and the vaccines which is allotted to you. So let us start with the BCG vaccine first. So I request the participant to unmute your video and audio and please present your topic. Go ahead.
Good morning, everyone. I am Aisha. Here to create awareness about some life-saving vaccines every child must receive for a healthy future. Let me talk about Bacillus calamity gori (BCG). Helps to protect babies from a serious type of tuberculosis. It is given as a single injection just under the skin. Healthcare professionals give it to ensure it's done safely. It is not suitable for people with weak immune system. Through the oral route. It is given at birth 6 weeks, 10 weeks, 14 weeks, and in booster doses. This vaccine works preventing paralysis caused by polio. To ensure its effectiveness, it is important to administer it on time and avoid skipping any doses. Thank you.
Okay. Thank you, Aisha. And the next person can start presenting.
Namaste everyone. Vaccines are the superheroes of healthcare and I am here to introduce the one of that safeguard our children's futures. I will take it through you inactivated polio vaccine IPV. It means inactivated polio vaccine is given to the children's because to protect against all the types of polio viruses. And I will be saying how much dose we have to take means 0.1 ml of a dose we have to take, and the route is intradermal, and the age is 6 weeks and 14 weeks, and action to enhance the immunity against the polio. And what we have to do means administer intradermally, and what we have not want to do means avoid skipping of dose. So this is all about inactivated polio vaccine. So we have to take the inactivated polio vaccine to protect against the polio viruses. So thank you. Have a good day.
Thank you, Sanjana. Thank you. So the next person can start presenting your topic. Mohita can start.
Yes, ma'am. Good morning, ma'am. Hello, did you know that a simple vaccine can prevent lifetime suffering? Let's talk about the vital immunization today. I want to share insight into a rotavirus vaccine. It is a vaccine administered to the infant and young children who are suffering from severe diarrhea and vomiting that caused by a rotavirus. Dose, it is not a vaccine but a drop medicine. So dose, we have to administer 5 drops. Route, orally by mouth. Age, we have to administer between 6 weeks, 10 weeks and 14 weeks. Action, it will prevent severe diarrhea in infants that caused by a rotavirus. Do's and do nots. Do's, we have to administer orally. Do nots, we should avoid the contamination. Thank you, everyone.
Thank you, Mohita, for your presentation. And the next vaccine can be presented by the next participant.
Today, as future healthcare professionals, it's our duty to spread awareness about the vaccines that protect children from any illness. Let's explore. Pneumococcal conjugate vaccine. The recommended dose of pneumococcal conjugate vaccine is 0.5 ml. The vaccine should be administered with the intramuscular route. The recommended ages for administering PCV are 6 weeks, 14 weeks, booster dose 9 to 12 months. PCV reduces severe respiratory problems and protect against pneumococcal infections such as pneumonia and meningitis. To ensure the effectiveness of PCV, it is essential to ensure proper storage and avoid delays. Thank you.
Very good. Thank you, Hitana, for your presentation. And the next person can continue your presentation. Sidra, you can start presenting your vaccine.
Hi everyone, let's dive into the essential role of vaccine in preventing diseases and ensuring a safe and healthy childhood. Allow me to provide an overview of pneumovirus vaccine. Dose, we have to administer 0.5 ml. Route, we have to administer intramuscular. Age, we have to administer during the age of 9 to 14 years old and to at least 2 doses. Action, it prevents cervical cancer. Do's and do not. In do's, administer before sexual activity begins.
Thank you. And next, I would request Sanjana to present influenza vaccine.
Good day to all. Vaccines are our best weapons against preventable disease. I want to share insight into the influenza vaccine. Influenza vaccine is used to protect against the influenza, such as like flu, such as headache, vomiting, nausea, etc. So dose is 0.5 ml, and the route is intramuscular, and the age annually from the for the children and adults. Actions, it will reduces the flu related complications. And do's and do nots, what we have to do means administer annually and do not avoid skipping of dose. And this is all about influenza vaccine, so we have to take influenza vaccine to protect against the influenza. Thank you.
Very good. Okay, Sayandana, continue the presentation. Sayandana, unmute your audio and video and talk.
Yes, ma'am.
Yeah.
Hello everyone. Today I am here to highlight the importance of timely vaccination, a simple yet powerful step in protecting our children's health. Let's take a closer look at DPT vaccine. Dose 0.5 milli, route intramuscular, age 60 to 24 months and 5 to 6 years. Boosters action prevent severe bacterial infections, does and does not administer on schedule, avoid delays. Thank you, ma'am.
Very good, Sayandana. And I request Rasya to present the next vaccine, vitamin A supplementation.
Good morning, everyone. In this awareness session, let's explore the vaccines that ensure every child gets the best start in life. I am here to explain. Let me introduce you to vitamin A supplementation. Dosage, we have to take 1 ml to 2 ml. Route, we have to give oral. Age 9 months and every 6 months up to 5 years. Action, it improves vision and immunity. Does do's and do not administered with MR vaccines and avoid overdose. Thank you, ma'am.
Okay, da, very good. So next I request Neha to continue the presentation.
Warm greetings to everyone. Let us discuss vaccines that form the foundation of healthy childhood and stronger communities. Allow me to shed light on measles rubella vaccine, also called as MR vaccine. 0.5 ml dose, root subcutaneous inner layer of skin. Age 9 to 16 to 24 months. Actions prevents measles complications and congenital rubella syndrome. Do's and do not. Ensure proper administration and delays. Thank you.
Okay, very good. I request Rosa to continue the presentation.
Morning, everyone. Greeting. Vaccination is the foundation of disease-free life, and I am excited to take about ones that every child should receive for a healthy future. I will share more detail about TT injection, that is tetanus toxin. The dose we are administered 0.5 ml of tetanus toxin. Route we are administered in intramuscular, and age we have to administer during pregnancy, that is 10 years and 16 years. Action is prevention tetanus information. Dose we are administered during pregnancy. Dose we do not avoiding skipping dose. Thank you very much.
Very good, Rosa. Very good. So now I request Devika to present the vaccine.
Hi everyone. Vaccination saves millions of lives each year, and I am here to highlight the importance of key vaccines we use in India. I will guide you through. Its dose is 0.5 ml. Its route is intramuscular, and its age is 6 weeks, 10 weeks, and 14 weeks. Its actions are prevents multiple diseases with one vaccine, combines protection against diphtheria, pertussis, tetanus, hepatitis B, and Haemophilus influenzae type B. Do's and don'ts. Administer on schedule. Avoid mixing with other vaccines. Thank you.
Okay, very good. So the next presentation can be continued by the presentation to whom I have allotted. You can start presenting one by one.
Hello and welcome. As a student of Surgery Institute of Nursing Sciences, I would like to share the important vaccines that are provided to our children. That is hepatitis B vaccine. We have to the dose we have to administer 0.5 ml. The route we have to administer intramuscularly. Age after a birth within a 24 hours. Action it will prevent acute and chronic liver diseases, protect against the hepatitis B virus, and this is a viral liver infection. Do's and do nots. Do's we have to administer within the 24 hours of birth. Do nots avoid the delays. Thank you, everyone.
Okay. So I think we have finished able to presentation. Rasya, what about your second presentation?
Good morning, everyone. Protecting children from disease start with timely vaccination, and today I will tell you about the 16 vaccines that make this possible. What is Japanese encephalitis? It is a vaccine protecting against the Japanese encephalitis, which is caused by the mosquito. What dose we have to take? 0.5 ml we have to take. At which route? Subcutaneous. Age 19 to 12 month and 16 to 24 month. What is the action? It prevents brain inflammation caused by Japanese encephalitis. Does and do not. Does administrate in endemic areas and do not. We have to avoid skipping doses. Thank you.
Okay, thank you, Rasya. So with this, we are coming to the end of this presentation. So any one of you share your experience, how it was, Mohita, webinar,
Ma'am,
how it was the presentation through online.
it will be easy if we are in front of face to face, ma'am. It will
Oh,
be good.
it was quite. I think it is more easier than standing in front of people. Is there no sitting
Yes, ma'am.
somewhere and speaking alone? Okay. So all of you take care of your health. And this is for today. And take care. We'll meet you tomorrow with the class. So this is about today. Thank you.
Thank
Thank
you,
you,
Thank
ma'am.
ma'am.
you, ma'am.